All, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Okay. Question number first. Greater and lesser sac of peritoneum is connected by which of the following? Options A. Foramen of Winslow. Options B. Foramen of Monaro. Option C. Foramen of Magni D. Options D. Mental foramen. The right answer is options A. That is a foramen of Winslow. Foramen of a Winslow is the only natural communicating foramen between the greater peritoneal sac and the lesser peritoneal sac. It is also known as epiploic foramen or the omental foramen. Okay, while foramen of a Monro is that foramen which is located between the lateral ventricle and the third ventricle. Okay, and the foramen of a Magen D, that is also known as median aperture, is a foramen which is present in a ventricular system, and it's a link between fourth ventricles and the cisterna magna. Cisterna magna is a region which is located in the brain, which is posterior to the medulla oblongata and located below the cerebellum. And the cerebrospinal fluids enter in the cisterna magna from the fourth ventricles. Okay, and the mental foramina is that bilateral foramina, which is located in the vestibular portion of the mandible, through which that nerve ending, such as mental nerves, emerges. Questions number two. Number of interosseous space between radius and ulna in ox is option C 1, options B 2, options C 3, options D no interosseous space. The right answer is options B, that is a 2. Number of interosseous space between the radius ulna in case of ox, that is 2, while the number of interosseous space between radius ulna in case of horse, dog and fowl is 1. Okay, interosseous space is nothing. It's a space between these two bone, that is radius and ulna. Okay. Questions number 3. Synonyms of radial carpal bone is options A pisiform, options B cuneiform, option C semilunar, options D scaphoid. The right answer is options D, that is a scaphoid. Okay. Synonyms of radial carpal bone is scaphoid. Synonyms of intermediate carpal bone is semilunar. Synonyms of ulnar carpal bone is cuneiform. Synonyms of accessory carpal bone is pisiform. Synonyms of fourth carpal bone, that is unciform. Okay. Questions number 4. First sesamoid bone is found between option C metacarpal and first phalanx, options B metacarpal and second phalanx, option C between second and third phalanx, options D between metacarpal bone. The right answer is options A, that is a metacarpal and first phalanx. First sesamoid bone is found in between metacarpal and first phalanx, while second sesamoid bone is found in between second and third phalanx. Okay. This sesamoids bone are of two type in case of ox. That's a proximal sesamoids bone and distal sesamoids bone. If we see that's proximal sesamoids bone, that is 4 in number in each limbs, 2 for each functional digits. Okay, in one limbs there is a 2 functional digits at presence. Okay, while distal sesamoids bones are 2 in number, 1 for each digits, and this is distal sesamoids bones are also known as navicular bone. Okay, and there are 2 proximal sesamoids and 1 distal sesamoids bone in case of horse. Okay, and there are 9 posterior and 5 anterior sesamoids bone in proximal groups, while distal sesamoids bones are cartilaginous in case of dog, and there are 2 proximal and 1 distal sesamoids bone in each digits of pig. Okay. Questions number 5. Iliosciatic foramina is found in which of the following? Option C horse, options B dog, option C fowl, options D ox. The right answer is options C, that is fowl. Iliosciatic foramina is found in fowl. Okay. Questions number 6. Horny papillae is found in options A rumen, options B reticulum, option C omasum, options D abomasum. The right answer is options A, that is a rumen. Okay. Horny papillae is found in rumen, while if we see that is the mucosal layer of this the uh, abdominal compartment, then we found that rumen is look like as like a towel. A honeycomb like mucosa, sieve like we found in case of reticulum. Ladies' purse like mucosal folds seen in case of omasums, and glandular glands are found in case of abomasum. Okay. Questions number 7. Entire development of the individuals is called options A ontogeny, options B phylogeny, option C embryogeny, options D all. The right answer is options A, that is the ontogeny. Entire development of the individuals is called ontogeny, while phylogeny is that ancestral history of the species, that's terms related to phylogeny. While embryology is that also the branch of that animal biology that is study prenatal development of gametes, fertilization, development of embryo and fetus. While teratogeny is study of congenital disorder that occur before birth. Okay. Questions number 8. Extensions duct is a part of which duct? Options A, parotid salivary duct. Options B, mandibular salivary duct. Option C, sublingual salivary duct. Or options D, buccal salivary duct. The right answer is options A, that is a parotid salivary duct. Okay. There are major three salivary glands, that's parotid, submandibular, and sublingual glands. Okay. Extensions ducts actually drain the parotid gland secretions opposite the upper second molar area. Okay, while Wharton duct drain the submandibular and sublingual gland secretions into the floor of the mouth near the free limbals of the trunks. Okay. Uh, there's a note that largest salivary glands of horse, that's parotid salivary glands, while zygomatic salivary glands is found in case of dog. Okay. Questions number 9. Falciform ligament is related to which organ? Option C, kidney. Options B, uterus. Option C, liver. Options D, stomach. The right answer is option C, that is a liver. Okay. Falciform ligaments is related to liver. There are major ligaments of the liver are as follow options. That's first is falciforms or anterior ligament, which attaches the parietal surface of the liver with the diaphragm, while round lateral ligament connect the dorsal surface of the liver to the caudal part of the diaphragm. We can see that round lateral ligament and falciform or anterior ligaments connect the liver with the diaphragm, while round ligament connect the umbilical fissure of the liver to the umbilicus. Caudate ligament attaches the caudal lobe of the liver to the right kidney, abdominal vena cava, and part of a pancreas, while lesser omentum attaches the along the portal fissures and extend up to the ossophageal notch, connect liver with the omasums and lesser curvature of the abomasum. Questions number 10. Duct of Bellini is related to which organ? Option C, liver. Options B, kidney. Option C, spleen. Options D, pancreas. The right answer is options B, that is a kidney. Okay. Uh, duct of Bellini is related to kidney. Duct of Bellini is also known as papillary or collecting duct. Is a narrow, long, narrow tubes which is in the kidney that concentrate and transport urine from the nephron to the larger duct that connect with the renal calyces. Questions number 11. Remnant of umbilical artery is present on option A, lungs, options B, gallbladder, option C, liver, options D, urinary bladder. The right answer is options D, that is a urinary bladder. Okay. Remnant of the umbilical arteries is actually present in urinary bladder. After birth, this umbilical artery retract into the lateral ligament of the bladder. Okay. While umbilical vein become the round ligament of the liver. Okay. There's a note that not only that pulmonary arteries and pulmonary veins, but also that's in case of umbilical arteries and umbilical veins, that's artery carry deoxygenated bloods and veins carries oxygenated bloods. Umbilical arteries actually carries deoxygenated fetal blood toward the placenta for replenishment, while the umbilical vein carry oxygenated blood from the placenta into the growing fetus. Questions number uh, questions number 12. Trigone is presence at which organ? Options A, lungs. Options B, gallbladder. Option C, liver. Options D, urinary bladder. The right answer is options D, that is urinary bladder. Trigone is presence at urinary bladder. Trigone is a triangular shaped regions which is located at the base of the bladder. It's mainly defined by the presence of there's a two ureteral orifice and there's a one internal urethral meatus. Okay. Questions number that is 13. Tracheal cartilage is incomplete in which of the following side? Option C, ventrally. Options B, dorsally. Option C, laterally. Options D, none. The right answer is options B, that is dorsally. Tracheal cartilage is actually incomplete dorsally. Uh, if you see that trachea is an elastic tube which is extend from the larynx to the level of the base of the heart. It is mainly made up of cartilage and membrane. Okay, there are about 50 to 60 cartilage in case of animal and 115 cartilage in case of fowl. In case of the animal, this cartilage are incomplete, look like a C-shaped, while in case of fowl, it is that complete tracheal cartilage ring is present. So it's look like a round in shape. Okay. This tracheal tube length is about 60 centimeter long. It's terminates by bifurcating into two parts, that's left and right bronchi. at the base of the heart and is having two parts, that's the cervical part and thoracic part. Cervical parts that from the larynx up to the level of the thoracic inlets, that comes under cervical parts. That from that thoracic inlet up to that the lungs, it comes under thoracic part. Okay, and the cervical part of the trachea is dorsally related to that esophagus up to the level of third cervical vertebra, and then the dorsal label. Then there's a longus colli muscles is located. Ventrally it is related to sternothyrohyoides muscles, and laterally to the carotid artery, jugular veins, vasosympathetic trunks, and recurrent laryngeal nerves. While thoracic part gives extra bronchus at the right side and ventilate at apical lobe of the lungs and known as apical bronchus. Okay, it's related dorsally to the esophagus and longus colli muscles, left laterally to the aortic arch, left axillary arteries and thoracic duct, and right laterally to the vagus and ventrally to the anterior vena cava, bronchocephalic trunks, and recurrent laryngeal nerves. Okay, if we see that it's microscopic level, the trachea is mainly composed of that outer adventitia layer, then there's a cartilaginous ring, and there's a submucosa coat, and there's a mucous membrane. Okay, questions number uh, questions number 14. Number of air sacs in fowl is options A 11, options B 13, option C 5, options D 9. The right answer is options D, that is a 9. Okay. Uh, there are 9 air sac present in fowl. 2 cervical air sac, 1 clavicular, 2 cranial thoracic, 2 caudal thoracic, and 2 abdominal air sac. Questions number 15. Animal in which one or both testes is retained in abdominal cavity is called option C hermaphrodite, options B gynandromorph, option C intersex, options D cryptorchidisms. The right answer is options D, that is a cryptorchidisms. Okay, animal in which both testis or one testis is retained in abdominal cavity, such condition is known as cryptorchidisms. Okay, hermaphrodite is an animal that appears as like a male or female but has both male and female reproductive organs, while gynandromorph is an animal whose literally whole body split down the middle or in the large sections, with one sections being male and the other sections being female, not just sex organs. Questions number 16. Which structures is included in spermatic cord? Option C, cremaster's muscles. Options B, vasa deferens. Option C, spermatic arteries. Options D, all. The right answer is options D, that is all. Okay. A spermatic cord extends from the internal abdominal ring of the inguinal canal to the upper end of the corresponding testis. Okay. Spermatic cord is composed of actually two bundles. There's a cranial and caudal bundle, which are enclosed by tunica vaginalis propria. Okay, through the cranial bundle, that artery, vein, lymphatics, nerves are passes, and also that cremaster's internus muscles also included in this cranial bundle. While the caudal bundle only include vasa deferens. Okay, and then again both the bundle are covered by tunica vaginalis reflexa. Okay, and if we see that's blood supply, the spermatic artery from that aorta, artery of the cord from the external iliac, and artery of vas from that umbilical artery supply to this spermatic cord, while nerve supplies is actually done by spermatic plexus. Questions number 17. Colliculus seminalis are related to which organ? Options A, urethra. Options B, bladder. Option C, liver. Options D, spleen. The right answer is options A, that is a urethra. Okay. Colliculus seminalis is a rounded prominence which is situated on the ventromedial wall of the urethra. It is about 5 centimeter caudal to the urethral opening from the bladder. Okay. Questions number 18. Urethral sinus is present in which animal? Options A, dog. Options B, ox. Options C, horse. Options D, pig. The right answer is options C, that is a horse. Urethral sinus is seen in case of horse. Okay. Questions number 19. Corona glandis is present in which animal? Options A, dog. Options B, ox. Options C, horse. Options D, pig. The right answer is option C, that is a horse. Corona glandis is present in horse. Okay, and we see that the penis of horse as comparison to the ox, it is more thicker and more that short. Okay, and at the base of that glands there is a border which is known as corona glandis. Okay, we can also see that, and the corpus cavernosus penis, which form the bulk of the organs, contain numerous trabeculi and erectile tissue in penis of horse. Okay, and if we see that penis of dog, that os penis, which is a bone, visceral bone, which is present in a penis of a dog, is present at a cranial portion of the body of the penis of a dog. Okay, and there's also external urethral orifice which is actually present at the tips of the glands in case of dog. Bulbous glandis, which is the enlarged caudal part of the glands, is present at a penis of a dog. Okay, and if we see that's penis of a boar, then the cranial part of a penis, it's found twisted, and there's a sigmoid flexures is also present in case of a boar. Okay, just above the orifice of the prepuce, there is an ovoid bland pouch known as preputeal diverticulum is also seen in case of a boar. Okay, while sigmoid flexures absence in case of horse and dog. Okay, and note that the penis is actually a cylindrical copulatory structures. It's mainly consists three part, that's root, body, and glans. At a developmental stage, this genital tubercle at cranial end of a cloacal membrane that lengthen to form phallus, and from this phallus this penis is formed. Okay, questions number 20. Which structure is not related to female genital system? Options A, mesoovarium. Options B, Graafian follicle. Option C, tunica albuginea. Options D, tunica vaginalis. The right answer is options D, that is tunica vaginalis. Okay, mesoovariums is a portion of that broad ligament that actually covered the ovary, while Graafian follicle is a matured, ready to ovulate follicles which is present in ovary. Okay, while tunica albuginea is a thick, fibrous connective tissue that cover the ovaries and testes both. Okay, well, tunica vaginalis is a pouch of serous membranes, which is actually derived from peritoneums that cover the testes only. Okay. Questions number 21st. False nostrils and diverticulum nasi is present in options A, horse, options B, fowl, options C, pig, options D, ox. The right answer is options that is A, horse. Okay. False nostrils or diverticulum nasi is present in horse. Okay. If we see that inside the equine nostrils, there is a long cutaneous sac which is known as false nostrils or diverticulum nasi. This diverticulum nasi is actually located caudal to the nostrils, and it's easily palpated by pressing a finger into the nostrils in a caudal lateral directions so that the finger is close to the skin surface. Questions number 22. Diaphragm is rudimentary in options A, horse, options B, fowl, option C, dog, options D, ox. The right answer is options B, that is a fowl. Okay. Diaphragm is rudimentary in case of fowl. Questions number 23. Number of mammary gland in male is options A 2, options B 4, options C 10, options D 12. The right answer is options A, that is a 2. Okay. Number of mammary gland in case of male, that is 2. Number of mammary gland in case of bitch, that is 10. Number of mammary gland in case of cattle, that is 4, which is situated in the inguinal regions, 2 on either side of the median line between the thigh. Okay. Number of mammary gland in case of pig, that is 10 to 12 in number. Okay. Note that mammary gland is actually accessory organs of reproductive systems, which is a develop with influence of hormones during puberty. It is a modified sweat gland. Okay, the duct system of mammary gland is actually developed under the influence of hormones estrogens, while the gland alveoli systems develop under the influence of hormones progesterone. Okay. Questions number 24. Cisterna chyli is a reservoir of which of the following? Option C, lymph. Options B, blood. Option C, bile. Options D, saliva. The right answer is options A. That is a options A. That is a lymph. Okay. Cisterna chyli, which is also receptaculum chyli, is a dilated sac which is located at the lower end of the thoracic duct, into which that lymph from the intestinal trunk and the two lumbar lymphatic trunks flow. Okay, it also receive fatty chyle from that intestine, and it's act as a place for lipid product of digestions too. Questions number 25. Yes joint form in which articulation? Options A, occipito-atlantal articulation. Options B, atlanto-axial articulation. Option C, coccygeal articulation. Options D, none. The right answer is option C. That is a occipito-atlantal articulations. Yes joints forms in occipito-atlantal articulations, while no joints forms in atlanto-axial articulations. Questions number 26. Nerve supply to lateral rectus muscles is accomplished by options A, optic nerve, options B, oculomotor nerves, options C, trochlear nerves, options D, abducens nerves. The right answer is options D, that is abducens nerves. Okay. Abducens nerves supply to the lateral rectus muscles of eye. Let's see some muscles of eye and also their nerve supply. And if we see that's extraocular muscles, there are two types of extraocular muscles, which is voluntary muscles and involuntary muscles. Under voluntary muscles, we found three types of muscles. That is a levator palpebral superioris muscles, or rectus muscles, four rectus muscles, and two obliquus muscles. Okay, superior inferior two obliquus muscles and superior inferior lateral medial rectus muscles. Okay, and if we see that the superior obliquus muscles supplied by trochlear nerves, while levator palpebral superioris muscles is supplied by oculomotor nerves, okay, while lateral rectus muscle supplied by abducens nerves. Beyond these two muscles, that is lateral rectus muscles and superior obliquus muscles, all others muscles are supplied by oculomotor nerves, okay. And involuntary muscles, which include superior tarsus, inferior tarsus, orbitalis, okay. There's a note that trochlear nerves actually origin from behind corpora quadrigemina of that brain. Olfactory nerves origin from that olfactory bulb. Optic nerve origin from that optic commissures, and mixed longest nerves, that is a vagus nerves, which also known as a pneumogastric nerves too. Okay. Questions number 20. 7. Median fibrous raphe, which is extend from the xiphoid cartilage to the prepubic tendon, is option C, linea alba, options B, inguinal ligament, option C, Poupert ligament, options D, none. The right answer is options A, that is a linea alba. Okay. Median fibrous raphe, which is extend from the xiphoid cartilage up to that prepubic tendon, that is known as linea alba. This linea alba is a thin band of connective tissue that runs down in front of the abdomen that separate the left and right side of the rectus abdominis muscles. Linea alba is highly elastic, strong, and white in color. Okay. While inguinal ligament, also known as Poupert ligament or groin ligament, is a band which is running from this prepubic, that's pubic tubercles to the anterior superior iliac spine. Okay. Questions number 28. Which is the dental formula of the ox? Options A, 0033 by 4033. Options B, 3133 by 3133. Option C, 3142 by 3143. Options D, 21166 by 61146. The right answer is options A, that is a 0033 by 4033. Dental formula of the ruminant is 0033 by 4033. Dental formula of the horse is 3133 by 3133. Dental formula of dog is 3142 by 3143. Dental formula of pig is 3143 by 3143. Let's see some fact about the teeth. That's most compact or hardest part of tooth is enamel. Substance form thin layer on root of the teeth, that is cement. Ivory-like part of the teeth, that is dentine. Cord-like structure which is located under the surface of the tongue of a dog, that is known as lisa. Wide mucus fold under the surface of a tongue, that is known as frenum linguae. Wide hard papillae at the floor of the tongue, that is known as caruncula sublingualis. Questions number 29. Hard palate of horse contain how many transverse ridge in each half? Options A, 15 to 19. Options B, 18. Option C, 8. Options D, 22. The right answer is options B, that is 18. Okay. Hard palate of a horse contain 18 transverse ridge in its half. Hard palate of ox contain 15 to 19 transverse ridge in its half. Hard palate of dog contain 22 transverse ridge in each half. Hard palate of pig contain 20 transverse ridge in each half. Okay. Note that palate is divided into two parts. That's anterior palate, that is known as hard palate, and posterior palate, that is known as soft palate. Hard palate form the roof of the mouth is mainly composed of dense connective tissue which is covered by mucous membrane. Small triangular structures which is located between the papilla, which is located on the midline between the dental pad and a first transverse ridge of hard palate, that is known as papilla incisive. Okay. Questions number 30. Area cribosa is found in kidney of which animal? Options A, horse. Options B, fowl. Option C, dog. Options D, ox. The right answer is options A, that is a horse. Area of cribosa is found in kidney of horse. Okay. The base and side are surrounded by the cortical tissue, and the apex protrude into the renal calyces. These protrusions are called renal papillae, which surface is perforated by opening of numerous papillary duct of Bellini, and thus the area is called that area of cribosa. Okay. Uh, Thank you. This much for today.